Hi. So, first and foremost, thank you all for joining us today. We are super excited to have Dr. Tracy Dantzler back doing an incredible presentation for us called A Day in the Life: How the Choices We Make Today Determine Our Health Tomorrow. And before I hand the floor over to her for a really incredible presentation, I'm just going to read a little bit about Dr. Dantzler. So, Dr. Tracy Dantzler is the former president of the Genesee District Dental Society. She served on the board of directors for Genesee District for 8 years, and she served as a delegate to the House of Delegates for the Michigan Dental Association. Dr. Dantzler is a native of Flint, Michigan, and she completed her undergraduate studies at the University of Michigan, Ann Arbor, and got her Doctor of Dental Studies degree from Northwestern University Dental School in 1988. Dr. Dantzler also received a Christian Counseling Certificate from Mount Zion Beecher Institute. Dr. Dantzler is a member of the American Dental Association, the Michigan Dental Association, and the Genesee District Dental Society. She's a fellow of the International College of Dentists, the American College of Dentists, and the Pierre Fauchard Academy. We are so grateful to have Dr. Dantzler here, and she is also the manager of the Utilization Review for Delta Dental of Michigan, Ohio, and Indiana. She is incredible and the reason that I still floss to this day. So, Dr. Dantzler, without further ado, please take over.
Oh, thank you so much, Bryce. And I'm so glad to hear that you're flossing now. That's like you get a gold star on your forehead for that one. I'm really honored to be here. I love educating the community. I love, interacting with the public. I did a lot of that when I was president of the Genesee District Dental Society. And education just, it empowers us. And so, I want to make sure that my life work makes a difference in people's lives. So I'm grateful to be back. I think the American Heart Association is amazing. I loved working with Sarah and Bryce last year, so I was really excited that they asked me to come back this year. Last year, I did talk about the connection between oral health and overall health, and that really is the main topic of today's conversation. But I spent a lot of time discussing a lot of science last time, but I want to bring it down into our everyday life because you have to be able to apply it to your life in order to see a change. Knowledge is one thing, but then we have to implement that knowledge into our everyday life in order to see a difference. So thank you. Next. So today I want to talk about the Anderson twins. 69-year-old Clarence and Walter Anderson are fraternal twins, and they were raised in different households. So just to give you a little bit of a background, fraternal twins share 50% of their DNA, much like other siblings. Identical twins will share pretty much 100% of their DNA. My dad was an identical twin. His twin brother is still alive. My father passed away in 2019, but I got to witness firsthand a lot of similarities between the two. They didn't just have the same genetic makeup, but it really expressed in their outer life. And there's a study that actually followed twins in both fraternal and biological, and identical twins. And I'll explain why that makes a difference. Clarence on the left here was hospitalized for coronary artery disease, for which he received 2 stents. And those stents open up your arteries so that the blood can flow to your heart. He was diagnosed 7 years ago with diabetes, which he has trouble controlling, and you'll find out why. His diet includes a high intake of pasta, bread, sugary desserts, soda pop, and alcoholic drinks. I think you know where we're going to go with that one. He's a smoker and he's not engaged in regular exercise. He's gained 25 pounds since his diagnosis of diabetes, and Clarence currently weighs 250 pounds. He rarely visited a dentist, and then only for a toothache. He has bleeding gums, and he's had a number of teeth removed. So I'm going to discuss the connection between oral health and our overall health. Walter, on the other hand, has avoided diabetes. Walter has recently had a physical exam at his doctor's office, and it showed that he was in good health, good heart health, good health overall. He enjoys pasta, sugary desserts, and alcoholic drinks, but he consumes them in moderation, and that's the key. So, in general, he chooses foods on a daily basis lower in fat and calories. And so, we don't want to take the fun out of life. We don't want to take the enjoyment out of life. I don't know why. A cupcake tastes a whole lot better than broccoli or spinach. But, at the end of the day, it's okay to enjoy those things, but only in moderation. And I'll talk a little bit later about the fact that, there are some substances that we should just avoid altogether. But for the most part, we can enjoy a good quality of life, but it's all about moderation. So Walter, throughout his adult life, has exercised 4 to 5 times a week for 30 minutes or more. He's never smoked, and he's maintained a weight of 165 pounds, which was a good weight for his height. Walter has had regular dental checkups from the age of 2 to current times, and he's in good dental health and has all of his teeth. One of the things that people don't understand is that as we age, we don't have to lose our teeth. And periodontal disease is the number one reason adults lose their teeth. If we control the periodontal disease as well as other factors in our lives, we have a chance to keep our teeth for a lifetime. They were created for us to keep for a lifetime. But depending on our lifestyle habits, that may not happen. So we see that the two brothers have very different levels of health at the age of 69. Clarence has developed multiple chronic systemic diseases, including diabetes, obesity, and heart disease, while Walter has avoided developing chronic systemic diseases, and in general, he has good health. So what can we point to that can help us to explain the large difference in health between Clarence and Walter? What causes systemic diseases like diabetes and heart disease? The likelihood, or another term for likelihood is risk, of developing a chronic systemic disease is linked to a person's genetics, their life conditions, and we know that these brothers had different life conditions. They were raised in different households, they had different caregivers, and apparently, were trained on a particular path that was very different. So our life condition, which when we're children and infants, we can't control, and our lifestyle and health choices, which as we become older and in more control of our life, we can, change and dictate. And all of those factors made across a person's lifetime will determine whether or not they're at higher risk of developing chronic diseases. So studies of twins have suggested that only 20% or less of the risk for developing a chronic systemic disease is due to a person's genetic makeup. And the rest of the risk is due to a person's life conditions, as I mentioned before, and their lifestyle and health changes. So that tells us that 80% of the power is in our hands, no matter what our genetic makeup is. When I was practicing dentistry, I'm now retired and work full time for Delta Dental. But when I was in private practice, we would, just like medical doctors, have to, take a medical, we'd have to have the patients fill out a medical history form, and we would go over it with them in detail. And my patients who had a family history of cancer and diabetes, early tooth loss from gum disease, I could just tell that they felt a little down, and they felt like, it's probably going to happen to me. And I always encourage them to not think like that. No, it doesn't have to happen to you. That's 20%, that's a 20% risk that you may develop these particular health conditions, but there's an 80% chance that you won't if you do the right thing. So it's obvious that for the Anderson brothers, they follow very different health lifestyles and made very different health related choices over the course of their lives. And I know that started in childhood. So what does oral health and dentistry have to do with chronic diseases like diabetes and heart disease? And this is the topic that I just love to discuss because I think a lot of people are just not aware of the connection between their oral health, which is the health of your mouth, and their overall health. The American Dental Association years ago started this big campaign, nationwide campaign called Healthy Mouth, Healthy Body. And it was amazing. It really served to educate the general public and even healthcare professionals, dentists and physicians, on the connection between oral health and overall health. If you have a healthy body, but you don't have, overall, in general, a healthy body, I should say, but your mouth you have disease, oral disease that goes untreated, that could eventually affect your overall or systemic health and vice versa. So there are common risk factors that I'll discuss. And these risk factors, I mean, they're pretty obvious, but I think that, people don't fully understand the biology behind it, the physics behind it. So smoking and chewing tobacco, of course, we know that's a risk factor, right, for developing not only oral disease, but systemic disease. So we've been able to make a correlation between smoking and tobacco chewing to oral cancer and other types of cancer. It's connected to heart disease, respiratory or lung issues, diabetes, and periodontal disease. And I'll explain a little later how that's all connected. Alcohol consumption, especially excess alcohol consumption, could lead to oral cancer or other types of cancer, heart disease, and periodontal disease. I had a patient when I first graduated from dental school. He and his wife and two children would see me on a regular basis. He actually was a pretty compliant patient in terms of, coming to his dental appointments and doing, I believe, what he said, what he should do at home, flossing, brushing properly, all of those things. But I knew that this particular patient had an alcohol abuse issue. Even though he didn't admit it on his health history form, he smelled like alcohol when he came to see me for every appointment. He was very nice. He was quiet. His behavior wasn't untoward or anything like that, but he reeked of alcohol. And, it had to be strong if I could smell it through my mask. And I wore a shield, and everything, but I could smell the alcohol. It was very strong. I had a very difficult time keeping him periodontally healthy. Even though he saw me on a regular basis, never missed his appointments, he had uncontrolled periodontal or gum disease. So his gums were inflamed. They bled a lot. Over time, they were swollen, and over time, he began to lose the bone support around his teeth. The bone in your jaw holds the roots of your teeth in your jaw. And as you begin to lose bone support from gum disease, that bone begins to erode away, so to speak. The teeth will loosen up and infections will occur. And sometimes we have to extract the teeth. If it's really bad and the patient doesn't see the dentist, over time, the teeth can actually just fall out. They don't even have to be extracted. They'll fall out. But I remember that being an issue with this particular patient. And another unfortunate problem that I had with him was that when I would give him anesthetic, it wouldn't really take. It wouldn't work very well. So alcohol hinders the ability of that anesthesia to reach the nerve, which numbs the area that you're working on so that the patient doesn't feel what you're doing. And so that was a huge issue with him. I could only imagine. I moved away from that state, and so I didn't follow that patient throughout the years. But I often wonder whether or not he's even still alive, or if he developed other health issues besides just oral health. We know that diets high in sugars and fats and salts can lead to obesity, oral cancer, once again, or other types of cancer. So sugar has been directly related to cancer, actually. Studies show that sugar can cause cancer cells to grow or tumors to grow. Diets high in sugars, fats, and salts can also lead to heart disease, diabetes, dental decay, tooth decay, or cavities. We know that, right? And I'll talk about why that is so important to know. Stress, which is really a big issue in society today, just because of the structure of society today, all of the different things that are going on in the world and even in our individual lives, where it's at work or at home. Just the structure of society today can easily cause a lot of stress. And if we're not handling that stress properly, that can lead to heart disease, even heart attacks and stroke. It can lead to diabetes, and I'll explain why. And it can lead to periodontal disease. One of the things I also remember when I was practicing dentistry was that my patients were dealing with a very stressful time in their life, whether they were going through a divorce, experienced a death in the family, if they were a college student and it was around exam time. I noticed that their gums were bleeding more easily, more often. They had gingivitis. And there's a direct correlation between that stress and gingivitis. And so, we had to take extra measures to keep that under control. And also a lack of exercise. We know that a lack of exercise could lead to obesity. It could lead to heart disease. It could lead to diabetes and even periodontal disease. But I believe that it's sort of indirectly related to periodontal disease, because if you develop, heart disease, obesity, or diabetes, then that puts you at greater risk of developing periodontal disease. And I will talk about that. Taking actions to reduce these risk factors for oral disease also aims at some of the risk factors for chronic systemic diseases. It's all connected. What I like to tell people too is when I was in school, I had to go to school for 8 years, just like medical students. So my undergraduate studies and dental school studies were identical to the courses that pre-med students had to take and medical students had to take. And so the difference was that we not only had to learn everything about medicine, but we had to learn dentistry as well. So we also had to focus on, the head and neck basically. And we learn more about the head and neck anatomy even than medical students, unless they became brain surgeons or general surgeons. But we had to learn everything, and that's because we can't separate the mouth from the rest of the body. Your mouth is connected to your body, just like your hand, your foot, your arm. I mean, it's all one. And so everything that I did in the dental office was, it had to be in line with, medicine. I had to know, for instance, what medications the patient was on so that I would know what not to give them. I had to know what their health condition was. If they had bleeding disorders or other chronic health conditions that would impact surgeries that I would perform, or even just basic treatment like cleaning the teeth. I had to understand whether or not they had heart disease, whether or not they needed to be pre-medicated with antibiotics. So I had to know everything about pharmacology. I didn't know everything about the body, because I couldn't just take their mouth out and work on that and put it back in. It's a part of the body. And so I really want to change mindsets and get people to think about and understand the fact that everything that happens in the mouth can impact the rest of the body, or anything that happens in our body can in fact impact our mouth. So having a chronic systemic disease can make you more likely to develop or even worsen oral disease. Okay, next. So diabetes affects the immune system and can increase the risk of dental infection, such as yeast infection of the mouth called candidiasis or thrush. If you think you have an infection in your mouth, make sure that you see your dentist right away. Don't hesitate. Poor control of blood sugar with diabetes can keep cold sores and cuts in the mouth from healing quickly. Once again, it's because your immune system is compromised at that point. And people with diabetes may have less saliva and find that they have dry mouth. We call that xerostomia, but another term is dry mouth. That means that with less saliva, more sugars can stick to your teeth, increasing your risk of tooth decay, particularly at the gum line. If dry mouth does happen, drinking water can help. Chewing sugarless gum can help, but there are also medications that you may have to get at the pharmacy that can stimulate those salivary glands to start the flow of saliva again. So if your blood sugar is not under control, the risk for developing or worsening periodontal disease increases. If you have, if you have diabetes, keeping your blood sugar under control can help prevent or reduce oral problems. So having oral disease may make it more likely for you to develop or worsen chronic systemic diseases. So I call this, we say there's a two-way relationship or a bi-directional relationship between your oral health and your overall health. There's an increasing amount of medical research that points to periodontal disease or gum disease as a risk for developing or worsening systemic diseases such as diabetes, heart disease, and certain types of cancer, pneumonia, or even pregnancy outcomes. They've even been able to link periodontal disease with premature birth. And so the current thinking is that bacteria and inflammation chemicals, they're called prostaglandins, are produced from periodontal or gum disease And that bacteria and those markers, we call them, get into the bloodstream. They travel to other areas of the body where they may worsen or even trigger the diseases such as diabetes, heart disease, and other systemic illnesses. So we talk about inflammation a lot. So I mentioned that there's this two-way relationship between periodontal disease and diabetes. Having diabetes increases your risk of periodontal disease or gum disease and other oral infections, especially if the blood sugar is not well controlled. And we know that in Clarence's case, his blood sugar is not well controlled. Studies have also shown that the control of periodontal disease can significantly improve blood sugar levels in people with diabetes. So keeping your gums healthy, seeing your dentist regularly could help your diabetes to be under control. So we talk about inflammation a lot. Sugar, excess sugar consumption is closely related to inflammation. It's one of the foods and substances that we can consume that creates a great deal of inflammation. And when inflammation occurs, your immune system cells can become damaged. Those damaged immune system cells can in turn damage tissues in your body. So those tissues could be the lining of your blood vessels, for instance, and other organs. It could impact your gum tissue, cause them to bleed more often. Inflammation in the gum tissue, which is gingivitis, which can also lead to periodontitis, can also cause over time bone loss to occur in your mouth. And so inflammation is really a big issue. When people ask, well, how is that related to heart disease? Well, I mean, your blood vessels are carrying oxygen and nutrients to your heart and other systems and organs of the body. And if your blood vessels are damaged, then that's going to cause a problem. That's going to, cause you to be at a much greater risk of developing heart attacks and even strokes. Increased blood sugar causing that inflammation can cause the insulin resistance that we see with diabetes. It can cause gut health issues. A lot of people have heard the term leaky gut. So that could mean that the organs in your digestive system, like your colon, can begin to leak toxins out of the colon and into your bloodstream. And then those toxins are carried throughout your body to various areas of the body, areas that are perhaps weakened, and then those areas can develop diseases. And so that's another reason why, controlling your sugar intake is so extremely important. Not only diabetes and heart disease can develop, but arthritis, autoimmune diseases like lupus and multiple sclerosis. There's just a whole host of issues that can develop from inflammation. A lot of, the basis of many diseases, a lot of that is due to inflammation in the body that has to be well controlled. And what we're drinking and eating makes a big difference. Another thing I just want to mention too is that alcohol breaks down into sugar once it's digested in your body. Once it's consumed, it ultimately will break down into sugars in your body, and that's why it can lead to ultimately cancer, as well as periodontal disease, diabetes, and other issues if you're drinking too much or consuming too much alcohol. So while there's not 100% agreement on how strong the connection is, we know there is a connection. I saw it in my practice. If we treat periodontal disease and that patient maintains good oral health, then we're removing the potential risk for chronic disease. In my practice, I noticed as well that my patients who were diabetic, even if they were really responsible, they were good patients. They saw their doctor or physicians like they were supposed to. They took their insulin. They tried to control their diet as best they could. Some were actually very, very, very good with controlling their diet. And they saw me on a regular basis. They got their teeth cleaned, they flossed, they did everything they were supposed to do. And they were healthier. Those who did have that lifestyle were healthier than, of course, the patients who had uncontrolled diabetes. However, it was a challenge for me to keep them cavity-free and periodontal disease-free. They had more issues with gum disease, so I had to see them more often. If you have a healthy mouth, healthy gums, healthy gum tissue, then getting your teeth cleaned twice a year is fine, every 6 months. But if you have uncontrolled periodontal disease or gingivitis, then you should have your teeth cleaned, 3 times a year. So I would have to see those patients more often. And when I would see them, it was a challenge keeping their gums healthy. Some were better than others. And so I believe there were probably other health issues for some patients that, other patients with diabetes maybe didn't have other comorbidities, but it was more of a challenge. And another issue with my diabetic patients was that because their immune system was compromised, they developed decay a lot more quickly than other patients, than your average patient. And so let's look at how the decisions that are made early in life and our lifestyle early in life, our medical and dental choices impact our health in later life. We can't control, like I mentioned before, what happens to us when we're infants or even in the prenatal stages, and what happens when we're children, because we are dependent upon our caregivers and our parents more than likely. And but those choices that our caregivers make for us when we're infants, when we're children, can set us on a path of either good health or ill health. So let's look at the Anderson Brothers life course. From birth to age 1, our baby teeth begin to erupt as early as 5 months of age. Sometimes people develop a little bit later. Sometimes they develop a little bit earlier than normal, but around the age of 5 months, you're going to see the 2 lower front teeth come in, and then eventually 2 upper front teeth, and so on and so forth. So tooth decay or cavities can begin in a baby soon after eruption, and it can cause pain. It can prevent a child from eating correctly and hinder growth and development. And so the growth and development is going to be hindered because a child could become malnourished because they're not able to eat properly. When children have cavities in their baby teeth, they're more likely to suffer damage from cavities in their permanent teeth. We're fortunate that we do ultimately lose our baby teeth, but when those permanent teeth come in, that's it. If you lose a permanent tooth, another one is not going to grow in. So we really want to take care of our teeth, but it starts even with the baby teeth. That's why pediatric dental experts recommend that children see a dentist by no later than the age of 1 to start preventive dental program and to head off tooth decay. So we would even have, so by age 1, depending on, how cooperative or uncooperative the child is, we'll have the parent bring the child into the operatory, and we will have, what we call a knee-to-knee examination. And that means that I will be sitting knee-to-knee with the patient's parent, and that child will be laying in the parent's lap, but their head will be in my lap. And oftentimes the baby will start crying. Well, when they're crying, I can see in their mouth. So unfortunately, that's probably the only way I'm going to be able to do an exam on a child that age. But I've got my light on them. I have my mirror in my hand. And when they open their mouth to cry, I'm looking in there. I'm just doing a cursory exam. I can't do a comprehensive, thorough exam because they're not sitting still. They're not opening their mouth wide. And we're likely not going to be able to get radiographs, right? Unless they're sedated. But just doing a cursory exam lets me see whether or not there's anything unusual going on, whether or not the teeth are decayed because they'll be black or brown, or certain spots will be black and brown. It'll let me see whether or not the teeth are coming in at the appropriate time, certain things like that. So it's worth it. And also, if you think, well, why bring a child in that young? What difference does it really make? Let's wait until they're older. But the thing is, it gets them used to seeing the dentist. It gets them used to, coming to, an office that's going to take care of their oral health. They become familiar with us so that, fear doesn't develop at an early age. We try to make the visits really fun. I'm definitely guilty of bribing children. I will have a treasure chest. I open it up before we even do anything, and I tell them, you get to pick any present you want. You get a new toothbrush, after we treat your teeth or after we do an exam. So, let's have some fun today. And even if they're uncooperative, I tell the parent, wait 6 months, bring them back in. If they come back in and they're still screaming and they're uncooperative, wait 6 months, bring them back in. And that's if I don't think there's a problem, if I don't see there's an issue. Because eventually, without fail, When you do that, one day when the parent brings a child in, the child is going to be cooperative. They see that this is a fun place. It's a place where, we just were nurturing and we want to take care of them. They haven't experienced any pain or anything like that. And they get to the point where they want to come. I mean, I've had children that through temper tantrums, the first several times their parents brought them, and then one day they just out of nowhere just changed, turned the corner, and they would cry if they couldn't come to see me. If their parents are like, well, no, you're not due to see Dr. Dantzler yet, and they would literally throw a temper tantrum because they couldn't come to the dentist. That's the mindset that we want to instill in everyone. So Clarence began with an early life disadvantage because, unlike Walter, he didn't have an early visit to the dentist. That set him at the beginning of a life path to poor dental health that likely also had medical consequences later on. So by age 3, most children have erupted all of their baby teeth, usually 20. They typically have 10 upper teeth and 10 lower teeth. As more teeth come in, the risk of tooth decay increases as well. So we have to make sure we're taking care. So the picture to the right illustrates a young child, unfortunately, who has what we would call or assume is baby bottle mouth. Because tooth decay starts with sugar on the teeth. If a child drinks a lot of sugary beverages, particularly for long periods of time, like with a nighttime bottle of juice, they can develop a severe form of tooth decay that we call baby bottle mouth or baby bottle caries, and it requires extensive dental treatment. This is when it's not fun. This is what we don't want to happen early in life because we know now that this child is going to need major dental work. They might need root canals performed on those baby teeth. They might need multiple fillings or stainless steel crowns. They might even need some extractions. I've even, seen cases where all of the baby teeth had to be extracted prematurely, and that creates a host of problems. You can only imagine how terrifying that is for the child. When they need treatment like this, I always recommend either a general dentist who is able to sedate the patient or to send the patient to a pediatric dentist because they're going to sedate this child. And oftentimes they'll even perform that treatment in an emergency room. So just imagine your child in an emergency room or an operating room, I should say, sedated under general anesthesia, having to have major work done. That's just not how we want to start life. Unlike Walter, Clarence began frequently drinking sugary beverages at this age, and he developed a lifetime habit of choosing sugar-sweetened drinks. I believe sugar is addictive. This habit led to the development of major tooth decay, which resulted in nighttime trips to the emergency room for pain and sporadic trips to a dentist for tooth extractions. So we can see already that Clarence was not seeing a dentist regularly for preventive treatment, where if they saw that there was a problem, they could take care of it before it became a big issue. He only went to the dentist to what we used to call put out fires. So this, when he went to the dentist because he had a toothache or sensitivity or a chipped tooth or something of the sort, and he would have that taken care of, and then he wouldn't go back until there was another problem. We definitely don't want to do that. You don't want to end up in the emergency room at the hospital either, but it definitely happens. So let's look at school age from 5 to 18. A child's permanent teeth begin erupting between ages 6 and 7 and continue as the baby teeth are lost. Because tooth decay also attacks permanent teeth, particularly if a child has a diet rich in sugar-sweetened foods and drinks, it's important to continue regular dental visits, to continue preventive care, and to catch and treat the decay early, like I mentioned before. And I just want to mention that by the age of 12, typically all of the permanent teeth have erupted. All the baby teeth are typically gone by that time. Most of the time, you don't have your wisdom teeth in just yet. They come in a little bit later, typically between the ages of 18 and 24. But then again, that does depend upon the development of the child. Some do develop a lot sooner than others. But typically, all of the permanent teeth, with the exception of their third molars or wisdom teeth, as we call them, are in by the age of 12. And it's very important for sure to take care of your teeth at this point because this is the last set of natural teeth you're going to have. This, and so between the ages of 5 and 18, especially the older children, at that age, this is when alcohol and tobacco use can begin. It's, disheartening as that is, it's a reality, and because they're exposed to, alcohol and tobacco, sometimes even at school. And this is a really, really important age where contact with dentists and physicians can provide counseling. I can always tell if somebody's been drinking. I can always tell if someone smokes. They smell like smoke. They can't get rid of it. I don't care how much, cologne or perfume they spray on themselves, or how much, mouth rinse they use. Like, I know if they are smoking or, consuming alcohol, and it's a perfect opportunity for me to counsel that patient very lovingly, but very directly. So Walter, the healthy twin, was guided during this time of his life to adopt healthy choices and behaviors by his doctors and family. And Clarence was not, unfortunately. Clarence developed lifelong habits of sugar intake, smoking, and alcohol consumption that set him on the road to chronic disease later in life, both systemic disease and oral disease. So during this time of life, between the ages of 18 and 21, young adults may focus more on their lifestyle and neglect keeping preventive dental treatments. And I saw that as well. Families that were really, really good about, bringing their children in from a young age. The parents were able to, while the children are at home and under their control, oversee the children's diet and their lifestyle. The parents would tell the children too, when they got a little bit older and they weren't brushing their teeth themselves, they were telling the children, brush your teeth, wash your face, and go to bed. You could do that. You're feeding them healthy foods, hopefully. But when they become young adults, especially at the end of point of college, their life is full of pizza and burgers and fries, and sometimes alcoholic beverages, definitely soda pops and sugary drinks. Even like Gatorade, the athletes would drink that. They think, well, that's okay. That's like giving me energy. Gatorade has so much sugar. I saw so many of my young athletes would come to see me and have multiple areas of decay because they were drinking Gatorade. So, they're free to do that. They're free to choose that at their age. But that's when I start seeing issues. At this age, too, their previous habits, like I said, of healthy eating goes by the wayside in favor of these fast food, high sugar, high fat, high acid drinks. And so I see more tooth decay during that time and periodontal disease as well, because they're not brushing as well or flossing as well. If these habits of alcohol and tobacco use become ingrained in your life, then it's setting that young person up for later chronic diseases. So those diseases may not manifest when you're younger, and you just think you're invincible. But later in life, just like Clarence, it's going to show up eventually. It's going to catch up with you eventually. And I always like to say too that tobacco is just one of those substances that you should not, use at all. You can have alcoholic drinks in moderation if you don't have an alcohol abuse issue, but smoking, vaping, there's absolutely no reason why anyone should do that. There's no study that states that, you can just do that periodically and, you can control it. You can't. There are addictive substances in tobacco, and it just causes so much destruction in life. So during this phase of life between ages of 18 and 21, Walter missed a couple of dental appointments. That's normal. We're human. But he caught up with his dentist after that. He kept a reasonably balanced diet for his age and started a lifetime of regular exercise. On the other hand, Clarence increased his use of tobacco and alcohol, established a habit of eating high sugar and high fat foods, and lost 2 more teeth. And he also did not engage in regular exercise. So we can just see where his life is heading. So, I talked about, all the dangers of poor eating and alcohol abuse and, smoking and not seeing your dentist and physician regularly. But I want to give you some positive information. I want to give you some oral health recommendations that, hopefully you will take to heart and make changes if needed. We recommend that you brush your teeth twice per day with a soft toothbrush. So minimum of twice a day. If you're brushing twice a day, that's great. 3 times, that's, wonderful, but twice a day is acceptable. We always want you to use a soft toothbrush, never medium and never hard. And whenever I say that, the first question is, well, why do they even make hard and medium toothbrushes? And I'm like, I really don't know. I think they should be used for cleaning the grout and tile on your bathroom floor, but definitely not for brushing your teeth. Hard bristled toothbrushes are a problem for a couple of reasons. Number one, you can brush away your gum tissue by using a hard or medium bristled toothbrush, and the gum tissue will not grow back. So you will see gingival or gum recession, which will cause more exposure of your tooth. And that area of the tooth that was covered by the gum is sensitive. So you can develop sensitive teeth because of that, as well as, like I said, gum recession, which in your smile zone or your front teeth doesn't look very nice. Also, you can actually brush away your enamel, which is the outer surface, the outer hard surface of your tooth. And when you brush away your enamel, that underlying tooth structure called dentin is exposed. It's sensitive, so now your teeth can become sensitive for that reason. And it needs to be covered by a filling. Bonding, usually we do composite bonding in those areas in order to protect that underlying surface. Also, when the enamel is gone, that underlying tooth structure is softer and it is more susceptible to developing decay or cavity. So we have all kinds of issues with these hard bristled toothbrushes. And I can't overestimate how strong those bristles are. Enamel is the hardest substance in the human body, and it covers the teeth. So when you smile, that the surface of the teeth that you see is enamel, okay, and the crown portion of your tooth. Um, Even with mass disasters, when you hear about sometimes, and I don't mean to be grim, but if a person's remains have to be identified because, either they were in a fire or plane crash, and or some other type of disaster, sometimes the only thing left are their teeth. And that's because enamel is just that strong. So can you imagine that constant brushing with a hard toothbrush can actually brush away enamel? That's pretty strong, and that causes a lot of damage. But another analogy that I like to use is, let's say you have jelly on your counter and you have a scrub brush, and you start trying to remove that jelly with that scrub brush, and you know that it's just going to be a film that disperses. It may thin out, but you're not going to remove that jelly with the scrub brush. But if you take a soft cloth, then you can remove all the jelly from the counter. Well, it's the same concept. With a soft toothbrush, the softer the bristle, the more effectively you're removing plaque from your teeth. Plaque will occur, it begins to develop even after 30 minutes of brushing. So we can't just get rid of plaque permanently forever. It just keeps developing. So even if you brush thoroughly, plaque will begin to develop again on your teeth. It's not bad as long as it doesn't overgrow. But if you're not removing it properly the first time, because you're either not brushing the right way or you're using a medium or a hard bristle toothbrush, then you're going to leave a lot of plaque behind. You may not even see plaque. When plaque builds up a lot, your teeth will become yellowish, and well, that's not pretty. We don't like that, right? But also that plaque contains bacteria, which causes inflammation of the gums. The plaque will begin to mineralize from the calcium in our saliva, and it will harden. And that's when it turns into tartar. And so then now that's hard, it's yellow, and you can't brush it away. No matter what you do, you have to see a dentist or a hygienist, and we have to use our instruments to scrape that tartar off the teeth. But excess tartar and plaque on your teeth will lead to periodontal disease, which ultimately can destroy the bone support around your teeth, causing you to lose your teeth prematurely. So, as well as, causing other systemic issues, because that bacteria will travel through the bloodstream, because we have a lot of blood vessels in our gum tissue that's going to travel through the bloodstream to other areas of the body, even to the heart, and cause other illnesses, other chronic illnesses. So literally brushing your teeth properly, using a proper toothbrush can, help prevent you from having a lot of other problems. use fluoride toothpaste with tartar control. So a lot of people ask me, well, what toothpaste do you recommend? I have no recommendations. It's what you like. I mean, I pick what I like, but just make sure that the toothpaste has fluoride in it because that helps provide a protective barrier over your enamel, and it protects that enamel from developing decay. And you also want to make sure that it has tartar control for the reasons that I just mentioned. Floss once a day. And I'm so happy that when I gave a presentation last year, there were some people that were listening and they started flossing every day after that. It's so important. If you're brushing properly, you're doing all the right things in terms of brushing, using a soft toothbrush, you're brushing in a circular motion, just using that technique that we teach you in the dental office, but you're not flossing, then you're not cleaning in between your teeth because those bristles cannot get in between your teeth. So if you're not cleaning in between your teeth with the floss, you're at more of a risk of developing cavities in between your teeth, as well as developing periodontal disease because that bacteria and plaque is trapped in the food. The food breaks down into bacteria. That's all trapped in between your teeth. So that's going to still cause a lot of issues. So please, please, please floss. And when I was in practice, I don't know what it is about that little tiny string, but people, my patients, even the really good ones, they hated the floss. They'd roll their eyes. I even had a patient, at the end of the visit, we give them their new toothbrush and a pack of floss. I had a patient give me the floss back. He said, Dr. Dancer, you can keep it. Just give it to another patient because I'm not going to use it. I'm just telling you now, I'm going to be honest with you. I'm not going to use it. And this was somebody that saw me on a regular basis. So I just, I read him the riot act, okay? And I made him keep the floss. I did not take it back. And I told him either he flosses, or, he's going to be in trouble with me. And he says, well, I can't even get to the back teeth. It's too hard. What if I just floss the front teeth? And I said, okay. I said, you don't have to floss in between all of your teeth. But the only teeth you're going to keep are the teeth that you're flossing. So you will end up losing the other teeth if you don't floss them, but the choice is yours. So just even if you're flossing once a day, you're making a difference. You're cleaning in between all of your teeth once a day. For me, I mean, I keep floss on me. It's everywhere I go. It's at my office. It's in my purse. If I'm at a restaurant, after I finish eating, I have to run right to the bathroom and floss my teeth. And you have no idea how excited I am when I see another woman in the restroom flossing her teeth, right? I just, I give her the high five. I just think it's amazing. So, I can't stress enough how important flossing is, and it doesn't take that long. So please include that in your daily routine. You should visit your dentist twice a year for cleanings and periodic exams, okay? If you do not have periodontal disease and your gums are pretty healthy, then seeing your dentist twice a year is fine. Getting your teeth cleaned every 6 months is fine. If you have been diagnosed with periodontal disease, then you need to see your dentist 3 times a year because otherwise we're not going to be able to keep it under control. Call your dentist right away if an emergency occurs. Do not delay dental treatment. If you do have dental disease, and once again, your first dental visit, the first dental visit for a child should be by the age of 1. So, I know that there's a lot of fear still, with going to the dentist for a lot of patients. Not everybody, we've come a long way with our processes, our procedures, the materials we use, the science, and we can make the visit enjoyable. I mean, for the vast majority of the root canals I performed went smoothly where the patient didn't feel anything. And so, we have come a long way, but a lot of times, mindsets are developed in childhood and early childhood. And it may be because that child had a very bad experience at the dentist and fear was instilled in that child and they carried it throughout their lifetime, even into old age. And so for those particular patients, even though they that fear didn't come from being in my office. I had to deal with that psychological aspect of it. So I spent a lot of time talking to my patients, really just counseling them and comforting them before we even started treatment. And so I was able to change a lot of mindsets and dispel that fear, of what could happen or what might happen. But that fear is one of the reasons why people will put off getting dental work done. And another reason is really not in a person's control, and that's just access to care. Some people do not have the financial resources or the access to proper dental care. And the problem with that is something as small as a toothache, a decay, which could ultimately lead to a toothache and infection, could ultimately end in death. And so, a story that I told last year, but I always, for anyone who didn't take this course last year, I talked about a young boy. His name was Diamante Driver. He was back in 2007. He was 12 years old. He was his mom was a single mom. She did have a job. She worked a couple of jobs actually, but they were very low paying jobs that didn't provide dental benefits. And uh, at the time, there were some issues with the paperwork. And so even though from a financial perspective, she qualified for Medicaid, there was some type of issue with the paperwork, and she lost her Medicaid coverage. So neither she nor her children could see a dentist during that time, or she'd have to pay out of pocket. And you can only imagine how expensive that could end up being. It could run into the thousands. And so one day Diamante complained of a toothache, but his younger brother had six decayed teeth, and you could just see them in that illustration that I showed earlier. I can only imagine his teeth look like that, where his mom could just see they were all black, and the young child, complained all the time that his mouth hurt, his teeth hurt. So when Diamante complained of one tooth hurting, she had to make the very difficult decision, and I can only imagine as a mom how hard that had to be. But she had to make the very difficult decision of choosing one son or the other. So she was able to save up enough money to take his brother to the dentist, and his brother was treated, but she couldn't afford to have Diamante see the dentist as well. So this toothache became more intense over time. It was to the point where, he was in excruciating pain, and she rushed him to the ER, and the ER doctor treated him for pain. He gave him a pain reliever, and he treated him for a sinusitis. It was an upper tooth, and he thought, it was sinusitis. You have to understand that, ER doctors are not dentists. We have to learn everything doctors have to learn, or physicians have to learn, and dentistry, but they don't have to learn dentistry. And so if they're not sure what the issue is, then, they may prescribe an antibiotic. They may give you something for pain and send you home. So that's exactly what happened. But the next day, he was in so much pain, and his face was swollen. His mom rushed him back to Children's Hospital. They immediately saw that there was an issue, and they rushed him into surgery, and he had to have brain surgery. They found that there was infection in his brain. During the healing process, he was still in the hospital. He had a seizure after that. They had to rush him back into surgery. He had to have a second brain surgery. But at that time, they realized that the offending culprit was an infected tooth. So I'm sure they brought in an oral surgeon, and he extracted that tooth while he was, under sedation. And, they hoped that would take care of the problem. Over time, he was in the hospital for about 6 weeks. Ultimately, Diamante died. He succumbed from, the infection that went to his brain. They were not able to get it under control. And this is really a sad case, and it's the most extreme case, but it does happen. It can happen, and it does happen. An $80 tooth extraction could have saved this child's life, but instead he endured excruciating pain, ended up having 2 brain surgeries, only to die, and his family incurred over $200,000 in medical expenses. That may seem very extreme, but it can happen. An abscess can start out as a very small localized area of infection, but then if it's an upper tooth, that infection can spread to the brain and cause death. If it's a lower tooth, that infection can spread to the throat, close off your airway, and cause death. And so it's very, very, very important. okay, that we take care of any issues that occur and don't wait. But we want to prevent them, right? So, and when to introduce a sippy cup by 6 months of age, we want to stop the use of a bottle by 12 months of age. No bottles or sippy cups in bed, because the way baby bottle decay forms is that the baby's crying, the parent puts the baby to bed and they put a bottle in the mouth to stop crying, but eventually the baby falls asleep. So the juice, it has sugar in it, right? And sugar is acidic and it breaks down the enamel. So that's just sitting, the teeth are sitting there in a pool of whatever liquid is in that bottle or sippy cup overnight. And eventually that breaks down the teeth and causes the baby bottle mouth. I recommend no juice in the first year of life. When you do start giving your child juice, water it down, 50% juice, 50% water. The child won't notice, but it does make a difference. And healthy snack choices promote a lifetime of healthy snack habits. Right, so between the ages of 21 and 60, over this time, harmful lifestyle choices, usually that have occurred over your lifetime, like smoking, heavy use of alcohol, poor nutrition, stress, lack of exercise, can hijack a person down an unhealthy pathway to multiple chronic systemic diseases. And the good news is that making the choice during this time to stop tobacco use, control alcohol consumption, reduce consumption of high sugar, high fat, high calorie foods, and counter stress with regular exercise can reduce, delay, or even prevent the development of chronic diseases, including oral health diseases. In Walter's case, as he moved into middle age, he made the choice to keep active, maintain a healthy diet, refrain from tobacco use, and keep preventive appointments with his dentist and physician. Unfortunately, Clarence stayed inactive. He kept smoking, drinking. He frequently ate high sugar, high fat, high calorie foods. He lost more teeth and developed diabetes and obesity and heart disease as well. And I would not be surprised if Clarence ended up losing all of his teeth eventually and ended up needing complete dentures. So we know that, by age of 60 and older, your health, we know that our health develops over our lifetime. Good and bad health pathways are created over a person's entire lifetime. It doesn't just happen overnight. So throughout our lives, we have a choice. We have a choice to increase the protective factors that improve our health and reduce those risk factors that diminish health. And so just consider, safe physical activity, even walking 5 times a day, even 4 times a day, really, per week, or 4 times rather, per week, or 5 times per week. Eating a diet lower in calories and fat, reducing your body weight if it's recommended, and maintaining good oral health, brush, floss, dentist. We want you to avoid smoking at all costs. Control alcohol consumption or get rid of it altogether if you have a problem. Reduce your foods high in sugar, saturated fats, and calories. Your lifestyle change can be a strong medicine at any age, the best medicine, actually. Healthy choices lead to a healthy life. Thank you so much for your time.
Thank you so much, Dr. Dantzler, for that incredible presentation. And I love you talking about healthy choices because they truly do make a difference. And now I'm going to ask you a couple of questions that we got in the chat. So our first one is electric toothbrushes. Do they work as intended? And is there significant differences between vibrating or rotating heads?
Wow, excellent question. Electric toothbrushes do work well. They do work well. Make sure that you choose a brush head that is it has soft bristles. Okay, we know that, right? But I've noticed that with my patients who had a difficult time, controlling the plaque and tartar buildup on their teeth, when they started using electric toothbrushes, whether they're sonic toothbrushes or they're vibrating, rotating, either one. I saw a dramatic improvement in the reduction of their plaque development. Yes.
Oh, great. That's
Excuse me.
awesome. Oh, of
Good.
course. I switched over to an electric toothbrush many years ago and I've never been happier. So I'm glad to know that you like them. So our next question is, there are so many mouthwashes out there. How do we pick? And should children use a mouthwash?
Very good question. Wow. I have an excellent audience here. I wish I could see you. Mouthwashes can help somewhat. I caution against using them too often because most mouthwashes have alcohol in them, a different type of alcohol than the kind that you consume. That alcohol kills bacteria, which is good, but we have bacteria throughout our entire body. And interestingly, we have more bacteria in our mouth than we do any other part of the human body. But it's there for a reason. It's good bacteria. And if we are gargling with mouthwash that has alcohol and it kills that bacteria, over time, it's not going to just kill the good, but it's going to start killing the bad bacteria. And we're going to end up having we're going to have an overgrowth of bacteria in our mouth. So it's going to cause more problems than you were trying to resolve by using the mouthwash in the first place. We use it because we want fresher breath, but that breath is caused by bacteria. And so if you have an overgrowth of it because you're using that mouthwash too much, then that could create a problem. Children, there's really no need for a child to use mouthwash, but if you want to give your child mouthwash, then they do make alcohol-free mouthwash. So I highly recommend alcohol-free mouthwash if you do use it.
All right. Thank you. That's wonderful advice. Our next question is, have you seen any instances where GLP-1s have had a negative effect on oral health slash tooth loss?
Oh, that's a good question. I am not aware of that. I don't know enough of the science of the GOP ones. I mean, they're still doing studies, and I'm hearing that there are a lot of side effects. So I'm not sure, how that will ultimately impact the oral health. I can imagine that quite possibly it could. GLP-1s are supposed to help, control blood sugar, which I would think would improve oral health. But I do know that there are some people that are having issues with, malnutrition, for instance. And if you do have, malnutrition, you're not getting the proper nutrients that you're supposed to get, you're going to be at a much higher risk of developing periodontal and gum disease.
Thank you. Last question. I know that you spoke a lot about, sugary drinks and things in your mouth, and causing decay. And now there's a new popularity in zero sugar drinks, whether they be sodas or other things. Are those also causing problems with decay like their sugary counterparts?
Oh, that's a very good question. I am not aware of any studies that show that sugar-free drinks will increase your risk of decay, but there's a problem there. If they're artificially sweetened, typically those artificial sweeteners can cause other systemic issues like inflammation in your body, just like sugar would, right? Which can then lead to, periodontal disease, maybe not decay per se, but diabetes, heart disease, and other issues. They've even linked, these types of sweeteners to cancer. And so you're kind of switching out one issue for another. And so, like I said before, anything that's going to affect your system can affect your oral cavity as well.
Well, thank you, Dr. Dancer. Those were the last of our questions. We cannot thank you enough for joining us again. This was a wonderful presentation, and we so appreciate you being with us and helping make sure that we understand how to keep our mouth and our whole body healthy.
Thank you. I'm honored to be here, and I'm really proud of the American Heart Association for being oral health champions as well. Thank you so much, everyone, for your time.
Well, thank you, everybody. I hope you have a great rest of your day. And Dr. Dantzler, thank you again.
You're welcome.